Two local hospitals are combining their resources. Kettering Medical Center and GRANDVIEW Hospital merging.
In June 1999, under the leadership of Frank Perez, GRANDVIEW Hospital and Kettering Medical Center joined together, forming the union now known as the Kettering Health Network. The real strength of the network quickly became clear. In the year 2000, Dayton's Franciscan Hospital closed its doors, leaving over 13,000 indigent and disadvantaged patients without health care from Franciscan's Hopeland Clinic. With only 3 days' notice, GRANDVIEW Hospital assumed full responsibility for the clinic and its residency program. In order to provide improved care to these underserved patients, GRANDVIEW opened the Victor J. Casano Senior Health Center in 2003. The response to Franciscan's closing symbolized the unity of the Kettering Health Network. The compatibility of the osteopathic and Adventist philosophies is unmistakable. Both strive to compassionately care for the whole person and to improve the life of people in the greater Dayton area. As part of this mission, we reach out to care for children and adults with functional and behavioral problems. At Kettering Behavioral Medicine Center, patients find a safe and healing place to go for treatment of devastating, heartbreaking illnesses like depression, schizophrenia, drug dependency, and other mental illnesses. KBMC provides acute, residential, and partial hospital care, a wide range of services by highly trained advanced practice nurses, physicians, and fellows from Wright State University. Why offer these services? Because it's in keeping with the mission of Kettering Health Network to offer Christian-based, compassionate care to all those in need in our community. This same spirit of compassionate, community-based involvement has always been at the heart of the mission of Greene Memorial Hospital in Xenia. In the late 1940s, Greene County residents had to choose between going to Dayton for hospital care or relying on local physicians who would have a handful of patient beds as part of their office. To respond to this need, community organizations and physicians banded together to make the dream of a full-service, community-based hospital a reality. The community support was overwhelming. The original bond issue to create Greene Memorial was passed by 85% of the voters. A parade marked the occasion of laying the first stone in 1949. Then on April 22, 1951, a second parade through Xenia led citizens to the door of the new hospital for the opening ceremony. 2 minutes before the official opening, the emergency department welcomed its first patient, a man who had fallen and injured his shoulder. It was the beginning of a solid bond between Greene Memorial and the people of its community. Greene Memorial was county-owned until 1971, when it became a private, nonprofit institution. The commitment of the staff and physicians of Greene Memorial is uniquely illustrated by the response to the tornado of April 3, 1974.
Be prepared to take cover. A tornado has been sighted, and a tornado warning in effect for Montgomery, Greene, Clark, Champaign.
The hospital itself was untouched, but as residents began to flood the emergency department, the staff responded with compassion and skill, even though they were functioning without power or water. Caregivers, not knowing if their loved ones or homes were safe, remained on duty for long hours in order to provide for the injured. As one resident later said of the hospital, "We just took it for granted until April 3rd. In the decades that followed, major expansion and renovation projects have increased the volume and depth of service offered to the community. Greene Memorial Hospital has received local, state, and national recognition for innovative programming and commitment to excellence. The McMillan Cancer Center is nationally certified and in 2005 earned a perfect score from the Commission on Cancer. The John C. Hochtel Emergency Trauma Center is the only certified trauma center in the county and serves over 25,000 people annually. Diagnostic, rehabilitative, behavioral, and surgical services are all offered through Greene Health Partners facilities in every corner of the county: Yellow Springs, Beaver Creek, Fairborn, and Xenia. Once again, under the innovative leadership of Frank Perez, Kettering Health Network has entered into a collaborative partnership with Greene Memorial's parent organization, Greene Health Partners. This powerful combination continues Charles Kettering's vision of providing advanced medical technology in a community hospital setting. The future of Kettering Health Network is the cause of much excitement. Growth and change is occurring throughout the network. GRANDVIEW Medical Center's West Wing addition is now in progress. When complete, this 4-story addition will provide the hospital with an impressive new face. But even more importantly, it will include many key services, including 40 same-day pre-op and post-op rooms and a new cafeteria and kitchen. At Kettering Medical Center, the $72 million Benjamin and Marion Schuster Heart Hospital addition will soon be taking shape. The 5-story hospital will be built to accommodate the latest and emerging imaging technology. Patient care rooms, non-invasive testing, cardiac rehabilitation, and educational rooms within the building will further provide for the complete continuum of innovative cardiac care. The campus of Sycamore Medical Center has recently seen the completion of a major renovation, including a sleep disorder center, cath lab, oncology chemotherapy services, an outpatient pharmacy, expanded mammography services, and a new entrance from Ohio Route 725. The affiliation agreement with GREENE Health Partners will result in a $10 million investment in the renovation and expansion of services at GREENE Memorial Hospital and throughout Greene County. On the SOUTHVIEW Medical Center campus, the 80,000 square foot Yankee Medical Arts Center is complete and offers orthopedic and cardiology practices, MRI, and physical therapy services. At the Sycamore GLEN Retirement Community in Miamisburg, occupancy is at record levels, and assisted living services are being expanded to meet growing needs. Our family of over 50 satellite facilities continues to grow and expand, enhancing our ability to provide needed services right in the community. New facilities and upgrades to existing facilities are occurring in Beaver Creek, North Lebanon, Preble County, Huber Heights, and Bellbrook. The history of the Kettering Health Network is truly a remarkable one. The founders and early pioneers of the network came from different walks of life, with different philosophies and traditions. Yet the combination of heritages has led to something very special, a commitment to excellence that continues through the dedication, talent, and skill of the outstanding staff of the Kettering Health Network, making a significant difference in the quality of life in all of the communities we serve.
I believe that if you want to do a thing and want to do it bad enough and hard enough and willing enough to work for it, that thing will happen.